All right, everyone. Thank you so much for joining us today. Today, we're going to be discussing UCR Health and specialties, women's health, psychiatry, and neurosciences services. Today, we are joined by Dr. Mallory Stuparich as well as Dr. Gerald Maguire. Each of our physicians will be diving into a little bit more about who they are and what they do, as well as what we provide with UCR Health. So with that, Dr. Maguire is going to kick us off. And Dr. Maguire, you are up. Thank you so much.
Great. Oh, Stacy, and thank you so very much. I want to welcome everybody out there listening in, and I'm thankful to be presenting along with my colleague, Dr. Stuparich. So again, I'm the chair of Psychiatry and Neuroscience at UC Riverside School of Medicine, founding chair. Came out here right after the medical school got started, and I'm really happy to be here. So just finishing up my 7th year here as chair. And we've grown a lot since this medical school was founded. And unlike, say, maybe a common medical school theme across the country, I set my goal simply that within 5 years, definitely by 10 years, right? The metric that I could be looked upon as chair is the mental health of our community better? Because our Department of Psychiatry was founded 7 years ago. I believe the answer is yes. We'll look at that. And there's only so much that I can do as a physician myself, but bringing in other great physicians to work alongside me and other psychologists as well to complement the work of our physicians and working as a team and building for the long haul, not just in the care that we provide at our own clinic. We have one here in Riverside and one in Orange County, and then pivoting to be able to provide care throughout the state through telepsychiatry, but training the next generation of psychiatrists to care for the community that we serve. And we're well on our way with that. We have more students going into psychiatry percentage-wise than any other medical school in the United States, and I'm happy to lead that. And these are students from right here in inland Southern California who are staying to care for the community where they are raised. So I am a board certified American Board of Psychiatry and Neurology. I'm also a person who stutters. So I have taken on that focus on enhancing treatments for those who stutter. I'm very committed to the mental health care of our community as well, especially those with movement disorders and psychosis. It runs in my family. Unfortunately, I lost my oldest brother to suicide some years ago. So I'm committed to this field, and it's not a job. Psychiatry to me and teaching it's really a calling, and I'm just honored to really be here and to work along such a great team that we have here at UCR School of Medicine. I focus on our program that is the only university-based academic program in Riverside County. So, and we focus on the whole person care. Psychiatrists just don't give out medications. There's so much more. We are the specialists in mental health, providing that comprehensive care of talk therapy and integrated care, and being able to understand the families and the social networks, and being able to provide that expert medical advice. And of course, we've all seen this past year, the effect of the pandemic. I think we're going to learn about that there are far-reaching effects, and it's been a busy year for those of us in mental health. And unfortunately, I don't think we've seen maybe the light at the end of the tunnel is there for the infectious aspect of this pandemic, but its effect on society and mental health will be far-reaching into the future. And we are here for our community with UCR Psychiatry. If I may have the next slide, please. So in psychiatry, our services, I focus specifically on stuttering, but I also treat mood disorders and psychotic disorders, et cetera. My clinicians around me have a great group around us. We focus on those with anxiety disorder, attention deficit disorder as well, hyperactivity, focusing on children, adolescents, geriatric mood disorders for those with difficult to treat, or even run-of-the-mill bipolar disorder and depressive disorders. We're here for you, providing that specialized care for refractory treatments, utilizing the most advanced therapies, including clinical trials that we have. Special focus on Tourette syndrome and schizophrenia, obsessive compulsive disorder, post-traumatic stress disorder, other traumatic conditions, unique expertise in utilizing medications and psychopharmacology, but much more than that. Looking as well for the psychotherapy. We got Dr. Jamie Woods on board with her expertise in transgender care. Just recruited Dr. Todd Stahl, leading sports psychiatrist, focusing on our student athletes as well as our professional athletes and mental skills training. We also have great neuropsychologists, understanding from children up to geriatric, and that focus on the entire lifespan, including even looking at addictive disorders as well too. As we move on to the next slide. And with that, that's a focus that we have on psychiatry and what we can provide. Give us a call. We're happy to help. And another focus that we have, and so honored to be working with our colleagues in OBGYN about women's mental health. And we know that there's a specific challenges there that we know that we're working closely as part of an academic program to help our entire community with that. So with that, I turn things over to Dr. Stuparich, and thank you very much.
Well, thank you so much, Dr. Maguire, for that warm introduction. And I'd like to thank Stacy for the opportunity to speak to everyone today. And so my name is Dr. Mallory Stuparich. I've been with UCR Health for a little over 2 years now. And my primary practice focuses on gynecology as well as minimally invasive surgery. And I think that my approach to patient care is that I really want myself and the patient to be a team. So, whereas I've gone through training to have medical and surgical expertise in the realm of pelvic surgery and gynecology, only the patient is the expert in their values and what they want. And so I think that, we need to have a team-based approach to bring those two things together to be able to identify what the best and most individualized treatment is for the presenting gynecologic condition. And so a little bit of background about my training. So I did my medical school and my residency in general obstetrics and gynecology at the University of Texas Southwestern Medical Center in Dallas, Texas. And then I went on to pursue additional training through a fellowship in complex minimally invasive gynecologic surgery. And I did that fellowship at Maguire Women's Hospital, which is a part of the University of Pittsburgh Medical Center. And then, since a little over 2 years ago, I've been practicing with UCR Health. And in addition to patient care, I have a very big place in my heart for medical education. I'm actually the clerkship director, and I direct the third-year medical students who are doing their general clerkship in obstetrics and gynecology, manage their schedules. We teach them in the clinic, in the operating room, on labor and delivery. So I think that, as Dr. Maguire alluded to, it really is a calling to be able to train the next generation of physicians. And so that is a little bit of what I do outside of also caring for patients and performing surgery. So as I mentioned, my practice focuses mainly on gynecology as well as minimally invasive surgery. I see both patients who speak English as well as Spanish, but of course we have the opportunity to be able to serve patients who speak other languages as well. So with that, I'll go ahead and take it to the next slide. So a lot of patients, well, a good majority of patients that come and see me, many of them are coming to me with having issues with pelvic pain, more specifically with endometriosis, which can certainly be we can go back to the other side. So a lot of patients do come in knowing that they are interested in learning more about particular procedures or surgeries that I perform. A good majority of patients that I see suffer from pelvic pain, and many of them suffer from endometriosis, which is a well-described cause of pelvic pain. I also see patients who suffer from abnormal bleeding, patients who suffer from bleeding once they've gone through menopause as well as the whole range of comprehensive gynecologic conditions as well. So the services and procedures that I perform include some of the things that are listed here. May include laparoscopic surgery for endometriosis, performing hysterectomy in a minimally invasive fashion, as well as various other procedures that you see listed here, many of which can actually be performed in an office setting, which we find can be very convenient for patients and their support folks who attend appointments with them. We can go to the next slide. So I already alluded to some of the conditions that I treat. A lot of patients will specifically seek me out because of the additional fellowship training, where I did have a large focus on caring for patients who suffer from endometriosis. In addition to patients who suffer from heavy bleeding, be it because they may have a polyp on the inside of their uterus or fibroids in their uterus, as well as various other conditions that you see listed here. Okay, and so yes, we are here and we are ready to see you for your any sort of gynecologic needs that you may have. In addition to the medical education piece of things, I have a passion for patient education as well. And so I'm hopeful that most patients leave their appointment that they've had with me having learned something that they didn't know before. And I want to use this opportunity to educate those listening about a couple of things that I mention very commonly to patients. And that number one is that painful periods that keep you home from work, that keep you not able to attend your classes, that cause a young menstruating person to call their parents to come get them from school, that is not normal. And there are specialists that can evaluate you and help you. Unfortunately, I think there's a lot of normalization in our culture and society of the fact that many times it's viewed as being acceptable, more so for people who have a uterus and people who menstruate to be in pain. But that's not normal. And I would highly encourage you to seek evaluation for that, because there are options that we can discuss with you and we can help you. Fibroids are something that are very common. They're found in up to 80% of people who have a uterus, and there are lots of treatment options for them. And it's worthwhile to make an appointment to discuss with your gynecologist if that's something that you know that you may have. When I hear about patients who start bleeding again after they've gone through menopause, which the technical definition is somebody who has gone more than 12 months without a period in the absence of another cause of a person not having a period. Once people start to bleed again, that's definitely something that needs to be evaluated. And I would encourage anyone who's suffering from that condition to seek out an evaluation. And we at UCR Women's Health are happy to help you. And we look forward to speaking with you and seeing you.
Wonderful. Thank you both, Dr. Stuparich and Dr. Maguire. Just a few additional details for those of you who have joined the call today. Specialties at our UCR Health Comprehensive Psychiatry Services also include psychiatric assessment, psychiatry, psychotherapy, and additional items. If you're interested in making an appointment with us, you're welcome to give us a call or request an appointment online. We also have a web chat available, so if you have questions, non-medical questions, someone's there to assist you. As far as our Women's Health Center is concerned, different specialties include obstetrics and gynecology, reproductive endocrinology and infertility, all the way down to urogynecology. So really a wonderful resource for your medical needs right in our own backyard. And then the same idea with Women's Health, you're able to make an appointment by calling in or filling out an online appointment request. Our teams get back to you as quickly as possible. And for the most part, there's not too long of a wait, if any wait, to see our physicians. A few other fun points: we leverage MyChart patient portal, which means you have access to your healthcare and your doctors in the palm of your hand. So MyChart is also an app or accessible online. Allows you to do such things as medication refill, request an appointment, or just view past appointment details. And for those of you who are interested in continuing your education with UCR Health, we have free events every single month. Upcoming events in June include New Moms Boot Camp, hosted by Dr. Brenda Ross. We also have our multiple sclerosis disease mini-series. Session 3 is June 16th, hosted by Dr. Morrison Banks. And then we also have a stress management group medical visit. So our website has all of this information for you, and we invite you to view it.